New data may support a new push toward providing COVID-19 vaccine boosters for kids ages 5 through 11.
Here to answer your questions is Dr. Vandana Madhavan, the clinical director for pediatric infectious disease at Mass General Hospital for Children. Doctor, thank you so much for being here this morning. That data released by Pfizer showed that a third shot of a children's dose of their vaccine raised Omicron fighting antibodies by 36 times. What does that really mean? And what do parents need to know about all of this data? It can be tough to interpret sometimes.
Absolutely. I like to think about vaccines as rehearsals before a big show, practices before a big game. It allows the immune system to see a part of a virus or practice developing a response to a virus. But of course, without regular practices or rehearsals, that effectiveness is going to decrease. And we see this with other vaccines too. And of course, we're learning more about the COVID vaccines and how fast that happens in real time. And so with a third dose, it sort of re-energizes the immune system, allows them to practice or have rehearsals again and be even more ready for, the big show, the big game, if someone is exposed to the virus. And so we're seeing that with that third booster just gives even more strength to that immune response and allows a child to be better protected moving forward.
That makes it really relatable. Great example. Studies have shown that effectiveness of the Pfizer vaccine in kids ages 5 to 12 drops substantially during the Omicron surge, basically from 68% to a low 12% when it comes to getting COVID. Are we at the point where boosters are needed for that age group now?
Great question. I think one thing to remember with that data is that was just looking at infections and didn't really parse out infections requiring just supportive care at home, infections being asymptomatic, infections requiring hospitalization, and that vaccines remain very, very effective against hospitalization. So in the larger scheme of things, continuing to maintain a high level of protection against SARS-CoV-2, the virus that causes COVID, especially new variants, remains important to continue to maintain that protection against hospitalization and severe infection, which is what the primary goal of these vaccines is.
This is a big weekend for many families. Easter, Passover, and the Boston Marathon, too. A lot of people gathering. Still, we know a significant number of kids are not vaccinated as cases rise. What should parents be thinking about as they gather together this year?
Yeah, it's wonderful that people are going to be able to gather more, this year. But again, I've talked a lot about, family mask mandates and really thinking about who in the family might be at higher risk for complications, even if everyone is vaccinated and at low risk for complications, but there is a future event that's really important that people gather that someone might be at higher risk, really thinking about reinstating local meeting for the family mask mandates, thinking about limiting gathering size, keeping activities outside to really, think about the longer term implications. And even for children, even if they have mild illness, they're still out of school, for up to 10 days. And that can be really disruptive. So really, weighing the risks and benefits of the huge social benefits of being able to see friends and family and gathering, but remembering that an infection, even if mild, can be hugely disruptive to a family.
Very good point. And it's also mild enough to open the windows. So that's also great to have ventilation. Thank you.
Absolutely. Ventilation is also key.
Yeah. Thank you, Dr. Madhavan. Have a great weekend. Happy Easter.
You too.